The UK's National Health Service is witnessing record low public satisfaction. A new survey claims just 24% of respondents are satisfied with the NHS in 2023. The poll, conducted by the National Centre for Social Research, has been running since 1983. In 2010, the percentage points reached its highest at 70%. 14 years later, as of today, the public's view of the health service is down by an enormous 46% from its peak. According to British Social Attitude Survey, 52% of respondents are dissatisfied with the NHS, and the satisfaction with social care has fallen to 13%. Both the findings are the lowest since the survey began. The National Centre for Social Research polled more than 3,000 people across England, Wales and Scotland. Most of the respondents said that it takes too long to get a general physician or hospital appointment. Staff shortages at NHS is the second most cited reason, followed by low government spending on the National Health Service. The state of the NHS is one of the key topics in the upcoming general election. According to a poll by Ipsos, the majority of Britons identified the state of the NHS as one of the daunting issues facing the country. The General Secretary of the Royal College of Nursing, Pat Cullen, says voters must now make the NHS and care services as the central issue of the general election. Meanwhile, a spokesperson from the Department of Health and Social Care claims that progress is being made, while adding that the government is slowly achieving its goal of reducing the waiting list. Well, for more on this, we're joined by our correspondent Julia Chapman from London. Julia, we know just how important the NHS is to voters in the UK. Just give us a sense of the significance of this poll and its implications in this long-awaited general election.
Well, certainly health is going to be a major voting issue when it comes to the elections that we're expecting later on this year. It's something that many people have an interaction with and something they want to see the highest standards for, to ensure that they can trust that their health is in good hands. Now, this is a pretty stark look at how people are feeling about the National Health Service here in the UK. As you say, the lowest figure of satisfaction since this poll began in 1983. Just 24% of people are satisfied with the health service offered by the United Kingdom government, something that is funded by taxpayers in this country. And that comes after a record high back in 2010, which was when the Conservatives came into power. It's also a pretty stark fall since the COVID era. Of course, the COVID-19 pandemic has a lot to do with some of these problems in the health service. We've seen a big drop in satisfaction since 2020, and it isn't looking like it's going to recover anytime soon as the health service continues to be plagued by issues, by delays, by long waiting times, and now, of course, by strike action as well. We have seen long-running strikes in the NHS, which have pushed up waiting times. We've seen doctors, nurses, ambulance staff as well taking to the picket lines over the last couple of years as a cost of living crisis bit in this country. Many of those groups have resolved their disputes with the government and have seen a modest increase in their pay, but we're seeing junior doctors, who account for about 50% of the workforce of the NHS, still continuing to strike. As we speak, we're hearing that there will be another strike going forward. They've secured an extension to the ballot of junior doctors, having gone on strike already 10 times over the past year. They're calling for a really significant pay rise, saying that a lack of good pay is part of the problem with the NHS. They are saying that there are people leaving the health service, going into private medicine, going to other countries as well, and all of that is having a knock-on effect on the patients that are struggling to get appointments. We've seen waiting times at record highs a few months ago. They have come down since then, but those who are waiting for an appointment for more than 18 months, or rather for treatment for longer than 18 months, that number is still growing. In the last recorded month in February, that number was 14,000 people. That's something the government has vowed to abolish, making sure that there is nobody having to wait that long for treatment. They haven't managed to do that just yet. And as I say, voters will certainly be thinking about those kinds of considerations as they decide who to cast their ballot for in elections we're expecting later this year.